So I will be speaking on role of ophthalmic researcher in the current scenario. So some few words of truth and reality. I have an academic conflict of interest because I'm a professor and my views will reflect my academic standing. I do have a financial conflict of interest too, as I'm a practicing government surgeon and my views will affect whether or not I get referrals. I have a personal conflict of interest as I work passionately in my profession, so I may be biased. Most importantly, I know that I am talking to an extraordinary league of scientists and I need to share something that will improve their opinion of me. So I'm forced to make comments that I know they will wish to hear. So we have just seen a few months back that the Lancet and the any JM retracts. They are the Makkah, Medina, and the Gita of the research publications, but they retracted because the research was not original, that was not authentic. So what is happening? What is the purpose of research? To uncover truths. And number one is the reality, and the other important part is the validity. So truths, they are not equally generalizable, and all research is not equally justifiable. So importance of a research that requires a sample size of 1 lakh to reach a significant p-value will be far less than that of a research needing a sample size of 10 only. That is the difference. What is the importance of research? It's in the relevance of finding the great issues. First is the function, that is the capacity to act and implement. And the other thing is the feeling, that is towards the quality of life, how it can improve the quality of life. So the researchers, academic centers, guides, and funding agencies must consider truthfully whether a proposed study is intended to uncover a relevant truth, function, or feeling unbiased. So what must not be practiced? Dedicating time and energy for a pointless or impractical outcome, publication of an unconnected paper, support of a renowned researcher, and a prestigious department are just unjustifiable. The present system that is guided by financial gain, power, and prestige, most funds channelized to improve cataract surgery only and avoiding other important areas like glaucoma and community ocular health, avoiding those important parts. So there is an understatement. According to the vision for Horizon 2020, it states that vision researchers should never forget that beyond careers, publications, and funding, there are patients out there who need and expect a better quality of life. So please, researchers, once in a while, close your eyes and imagine what impact an eye-opening research has on people affected by blinding diseases and keep working for the good cause. So the role of ophthalmic researcher is far, far beyond imagination to be practiced in the near future. So these are the reasonable questions for the ophthalmic researchers. First is what is the purpose of research? Who decides what research should be done? Who decides that purpose? The investigator, the academic department, the university, industry, the state, the sick, or the well, because they don't want to be sick again. So there is a science behind every research. The science is to validate. And the penultimate aim of science is to provide results for the real world. Truth is need to be in harmony with the reality. So ophthalmic researchers' goal is to uncover and if possible to understand that external reality. Patient care, in contrast, only deals with relevance, whether the treatment or finding will be of any help in clinical care. Does validity address an important issue? Is unfortunately least concerned with most of the clinicians. Conflict of interest. It is a very important issue, and it's governed by the corrupting power of industry, which provided funding in controlling data, manufacturing needs, and influencing practice patterns. A financial gain from industry is always a conflict of interest. Industry is not the only one source of biased, self-benefiting research. Academic institutes funding for what they want, how to control data, manufacture need, and influence practice patterns. And the data from the ocular hypertension treatment study was not allowed to be seen by anybody except the investigators only. So what is happening? And when Yale University published Clausen's book, The Cartoons That Shook the World, they removed the cartoon. So where that title stands against the wishes of the author. So this is what's happening by the institute funding. So the importance of conflict of interest. These are an integral part. So no ocular researcher will survive if they don't honor COI mandatory for personal survival, nor would industry or universities or governments also. And conflict of interest are omnipresent and yet not detrimental. So it's important to handle COI well. So now there are few researchers who are saying no COI and yet falsifying data. So, but they are more likely to be believed. On the contrary, researchers who are disclosing many conflicts are often misunderstood by the audience that the presenter is biased, whereas COI policies are counterproductive in terms of science. Also, COI statements need to be validated. There is no method for these COI statement validation. So the research priority should be in accordance to a vision for Horizon 2020. There are 19 priorities in ophthalmic research like neuroglia interaction, gene therapy in retinal diseases, micro-incision cataract surgery, femto laser assisted surgeries, diabetic retinopathy, RMD, etc. But issues like improving care and care delivery in the third world countries and ocular healthcare within everyone's reach sounds an anomaly. And very few people are working on this. So does influence matters? I will quote one example. A great Philadelphia physician, Benjamin Rush, around 250 years ago, did a lot of for mankind. For example, he was one of the first individual to advocate for the abolition of slavery. And he was also involved in the founding the first new nation's first hospital. But he believed hypothetically in bleeding patients of yellow fever and believed that it helps in improvement. So in that course, he destroyed career of a young researcher who did a study which proved that patients with yellow fever who were bled were at no advantage than those who were not. And then there is this old school criticism towards new idea like prevalence of glaucoma in normal IOP range and ocular blood flow role. When the importance of ocular blood flow arises. So these European ophthalmologists at higher positions were totally dismissive of this data. And they didn't allow the researcher that funding, the young researcher. So the importance of studies and publication with no positive result. So there can be 4 results only. Obvious chance of patient benefit, 13% of the publications. Studies with reasonable chance of patient benefit, someday 30%. There might be more. There might be some chance of patient benefit, 42%, and no benefit to the patient, only 15%. So importance of every type of publication is important. We need to know those drugs who won't be beneficial in any particular ocular disease. So research for what? For promotion, name and fame only, or for the sake of mankind, or for the sake of science. So most of the researchers had no interest in being attached to the humans the science was supposed to be serving. So research, it is a complex issue between academia, industry, and research facility, and it is certainly not governed by the patient, unfortunately. So we have a lot of success in terms of genotyping, VEGF inhibitors, OCT and phacoemulsification with implantation of PCIOL. But how to influence behavior? Then there was 25, 50, 100 or 1000 years ago through word of mouth that this is the better choice of treatment or management in a particular disease. The answer is a disturbingly clear no. So for the ophthalmologist's career, it is becoming more a business rather than a profession. And the ophthalmic residents, they have knowledge of ethics, but they are lacking in ethical practice and behavior. And that behavior can only be learned by internalizing experiences shared with ethical mentors. And the evidence, when it comes to the evidence in the research, so the clinical trials, the multicentric clinical trials, they have a very important part to play. But to get results at a fast rate, so many researchers are working on surrogates and not on the patient who are going to be benefited. So this is the irony of clinical trials. The Hippocratic Oath is still used in many medical schools as something which the graduating students swear to honor, requires physicians to swear that they will not share their knowledge with anyone other than brethren. And research beyond cataract and flags it is just fair to be spending a major portion of research money on the development of instrument that will make things better for those who already are good and ignore those who are in dire need. So we need to have academic freedom and basic ammo. Research is certainly forgotten. So first we need to understand what reality actually is and how to benefit living creature. In summary, the methodologies of science can be applied not just to those subjects that are relatively easy to study, but to the truly great issue of mankind, how behavior can be understood so that it can be influenced in a way that individuals will be more caring and less violent, and more specifically for physicians, how ophthalmic researchers can be better guided to make sure that their actions are beneficial, fair, and enhance the ability of each person to care for himself or herself better. So without honest research and robust validation in our medical field, science simply going to die. And in this era of evidence-based medicine, we have simple retrospective study to complex randomized multi-centric clinical trials. And earlier obstacles like priority of healthcare, lack of funding, and infrastructural support from the institutes and non-conducive environment. That led to exodus of high-quality ophthalmic scientists from India, but tides are streaming in positive direction now. Up to 65% of US FDA trials are being outsourced to other countries. So in pre, post, and present COVID era, India is a great choice. More and more accredited and dedicated ophthalmic research labs are coming up with advanced communique and technique levels. And PubMed publication from Indian authors are on a manifold rise. The agency like IEC, ICMR, DBT, DST, and the foreign funding agency like the NIH, WHO are promoting ocular research in terms of funding and appointment. So definitely there is a silver lining for full-time ophthalmic researcher in vastly growing Indian scientific scenario. Thank you. Thank you so very much.